It's one of the fastest growing areas of healthcare. Medical equipment like pacemakers, wheelchairs, back braces, and diabetic supplies estimated to be a $70 billion industry in the United States.
But now scammers are taking notice of this explosion, trying to exploit patients and taxpayers in a new way. Even federal agents really never saw coming. Contact 5 investigator Katie LaGrone explains.
Good afternoon, Andersons. Can I help you?
In the world of healthcare scams,
walkers and wheelchairs and hospital beds and scooters,
durable medical equipment has long been considered a treasure for fraud.
things that are supposed to have a 5-year shelf life.
While honest suppliers like this one are selling, scammers are cashing in. Since 2012, the feds have cracked down on more than $600 million in durable medical equipment fraud. Florida remains the epicenter for a scheme now evolving, leaving even the most seasoned investigators baffled.
Why is Florida such a hotbed for this stuff?
There seems to be an environment somehow in which fraud thrives.
Ryan Lynch is the special agent in charge of Tampa's Medicare Fraud Strike Force team, one of 10 nationwide and set up to combat government healthcare fraud.
When you say that Florida is ground zero for this kind of fraud, does that mean the patients are here, the providers are here, the doctors are here?
Yes, yes, and yes.
According to Lynch, scammers are now committing medical equipment fraud using telemedicine, a growing trend where doctors use phone or video to treat and prescribe.
You have a whole group of doctors who are willing to write prescriptions for patients they don't have a relationship with, that they've never seen.
Here's how it works. A medical supply company pitches Medicare patients medical equipment the patient doesn't need or want. The same company also hires doctors who have no relationship with the patient, but are willing to rubber stamp prescriptions for the device for the right price, up to $150 per signature. Patient gets the goods, taxpayers foot the bill.
I told him I didn't want it.
Last month, this Medicare patient showed us the back brace he was sent after being harassed over the phone for over a year.
Go pick on somebody else. I'm tired of it.
Fraud investigators say anyone can wind up a victim of medical equipment fraud, and telemedicine, created for patient convenience, can make them more of a target to doctors out of state. And those patient names? Bought and sold on the black market.
Tens of thousands of names on the list.
These whistleblowers worked for a medical supply company out of this now vacant Delray Beach office, where they say thousands of Medicare patients got calls each week for supplies they didn't need, but made the company millions.
That's money that you and I as taxpayers have to pay for.
Dr. Jay Wolfson, a health policy professor at the University of South Florida, spent decades studying the impacts of Medicare fraud and abuse, now estimated to be $1 billion problem.
Most of it goes unnoticed and most of it goes unreported.
Patients have no idea.
In just the past month, Tampa's Strike Force has opened a half-dozen new medical device fraud cases, all rooted in telemedicine.
I would say it's a burgeoning problem.
And one more reason to care about all of this, if you receive medical equipment that you don't need, like this back brace, and you don't report it, when the day comes and you do need it, Medicare may not front the bill. So report everything you can about the company. Find out how by heading to our website. Katie LaGrone, WPTV News Channel 5.